The Competition Commission and COVID-19 testing kit suppliers, Ampath and Lancet, have reached an agreement to reduce the price of testing from 850 Rand to 500 Rand. And for agreeing to cooperate, the two companies won't have to pay a fine. Let's hear from Dr. Noluthando Nematswerani from Discovery Health. Thank you so much, Doctor, for your time. Let's just get an overall sense as to how Discovery feels regarding the cost reduction from 850 Rand to 500 Rand.
Thank you so much, Heidi, and good evening to the viewers. I think we do welcome the reduction in pricing, and I think from our side it is something that we've been engaging the path labs since the start of the pandemic. You will understand that testing obviously has been an integral component in terms of our fight against COVID-19. So this is something that we've been engaging the path labs about. So we really, happy that, at least there is a move, and we believe that this is the start towards a downward trend in the pricing of these tests.
Do you believe that 500 Rand is fair and reasonable, or do you think there needs to be a conversation about a further reduction? And the reason why I ask this is because many people have said this is a little too late, this should have happened a very long time ago, and initially we were paying over 1,000 Rand for tests, it then dropped down to 850 Rand, and now it's 500 Rand. This also poses a concern for people not opting to test because of how expensive it is. Do you think it should be reduced even further?
I think if we have to get testing more accessible to the broader public, I mean, we know that, yes, in the public sector, people go and get tested for free, but there's a significant amount of people who are testing privately. And I think it's a requirement for some people when they travel. Yes, from a medical schemes point of view, it is a prescribed minimum benefit, and therefore schemes do not have an option but to pay for PCR testing. So I think 500 is still, there's still room for further reductions in price, because 500 is not affordable to the general public. And I think for the schemes as well, 500 may not necessarily be affordable if you think about everything that schemes have to pay for towards COVID. So it's the testing, it's treatment for COVID, hospitalization, and everything that relates to COVID, including vaccinations.
Are you
so
able
we
to
do believe that there's still room.
Sure. Sorry to interject there. Are you able to tell us how much Discovery has paid in the last 20 months for PCR tests?
So we've paid over 2.1 billion Rand since the start of the pandemic. And this is for around 2.7 million tests that have been conducted for Discovery Health scheme members. So if you think about it, I mean, there are some other alternatives to testing, like the antigen test, which is slightly much more affordable when you compare it to the PCR. But, the introduction of the antigen test was only, towards the second wave. So the first wave, we didn't have any alternative. It was PCR at 850. And then second wave, we did have an antigen test. But I think, we still have a room for us also to introduce these other tests and make sure that the general public is aware of alternatives, specifically when they are symptomatic, because antigen testing is critical in testing for infectiousness. So for people who are symptomatic, there is an alternative that is cheaper, quicker turnaround times, and it is the antigen test. So while we welcome the reduction in prices for PCR, we also want people to be aware that there are alternatives.
Do you think this is going to encourage... Yes, sorry, continue.
No, I wanted to say, but obviously with the antigen testing, it's important for people to understand the guidelines, that, govern how antigen tests need to be done, the timing of the testing, so that you get the most accurate results.
Do you think that this is going to encourage people to get tested even more? Because many would say that previously they would just treat themselves, or if they suspected they had COVID-19, they would just isolate or just brush it away and hope it goes away because of how expensive this test is.
So I think it will encourage people, but also we need to remember that, like I said, testing is also a requirement for travel. So even when people don't necessarily want to test, there will be a requirement for them to test. So also, when we think about, the future where, if you're not vaccinated, taking into account the test kit price, and also obviously, the sampling and the performance of the test in the lab. So those are the tests, I mean, the prices, the costs that obviously we rely on the path labs to disclose so that we can have a full understanding and appreciation of how much it costs. So I'm not able to say what their costs are, but we believe that, there's still room for them to create efficiency in the pricing.
Sorry, I didn't get if you said how much you think an ideal cost would be for a test.
So I can't give you an exact cost because we rely on the path labs to tell us how much does the test kit cost them, what is the cost of doing the test, because they need somebody to do the sampling of taking the specimen, doing it in the lab. So if we can have transparency around those costs, then it's easier for us to say, okay, this is a fair price. But for now, our understanding of the test kit price, it is much lower, and I think over time those prices have reduced, which is what the Competition Commission has actually evaluated. And then the other additional costs have stayed obviously constant, but the test kit price has dropped over time. Okay, which is great. The biggest component of their cost. Yeah.
Okay, great. Thank you so much for your time. That was Discovery's Health, Dr. Noluthando, just giving us insights into the issue around test kits. Still to come on South Africa.